The health insurance companies did this to themselves. They spent decades putting out propaganda to justify their practices instead of addressing American frustrations. For years, health insurance companies in the US have pushed the narrative that their practices are necessary, all while the German healthcare system exists. First, they said that denying claims saves money for everyone. Claim denials rose by 31% in the last 2 years alone. Yet health insurance premiums kept going up and their profits soared. They framed their decisions about medical necessity as a way to provide people with options and making sure that hospitals and doctors were in check. Even while Germans are seemingly more limited in their choice of insurance provider, that doesn't lead to less coverage. Medical insurers are operating under strict national guidelines about what constitutes medically necessary care. Then they claim that their complicated appeals process is about protecting the system. Appeals take forever, and you have to send in things certain ways, and you have to do... The German system requires that a decision be made in 3 weeks, otherwise they pay automatically. US insurers made it so complicated that only 0.2% of denials were ever appealed. German patients can appeal for free and then, if necessary, take it to social court without legal costs. All of these necessary US practices leave people with medical debt. Over half of bankruptcies are tied to it. All while they just perpetuated this idea that the patient needs to plan better. And they act surprised when the public's anger gets to this breaking point. This kind of healthcare system, though, does not have to exist. And simultaneously, there exist healthcare systems, like in Germany, that protect patients and aren't putting out a bunch of lies to protect profits.
Yeah, 2 thoughts on this. Actually, tune in soon. We're doing an entire series. We're going to sit down with doctors from other countries and ask them what are the positives and negatives to socialized healthcare and their systems. That's number one. Number two, I do agree there's probably never been a time in which a healthcare company has cut costs, but also lowered premiums. If they cut costs, they add that to their bottom line, not yours.